So let me just go over a few areas where I really think this could be beneficial for older adults. Chronic pain, number one. Remember with this, low and slow. CBD, the benefits of CBD are often seen after, a month or so of regular use. THC, you'll feel that effect right away. So you want to be low and slow. Consider starting with a blended formula like I discussed. A 1-to-1's a pretty good neutral place to start. If you start with a low dose of a 1-to-1, I'd say that just generally without, knowing specifics for an older adult of their health profile, that a 1-to-1's generally a good place to start, low dose. Again, CBD, good for arthritis. THC, helpful for nerve pain. So as you're tweaking your dosing, if you have a lot of arthritis, you might consider going up a 2-to-1, a 4-to-1 of CBD to THC to get more of the benefits of the CBD, and the opposite for neuropathy. Often those patients find they do a little bit better with maybe a 1-to-2 ratio of CBD to THC. So, this is a very interesting treatment because it puts a lot of the control in the hands of the patient or the patient's caregiver, whoever's kind of planning the dosing of this medication, and getting knowledgeable about these compounds that you're working with is important. When it comes to chronic pain, I want to say that I see best results with a layered treatment. That means combining one or more methods to attack the pain in more than one way. I really like the idea of a localized option in addition to an edible. So, a low dose edible that you would ingest, and then using a pain cream on top of that, on your knees or on your hands. Or if you have lower back pain, degenerative disc disease, herniated discs in your lower back, consider a suppository. I have a lot of patients that get good relief with that. Additionally, if they're on opioids, the suppository can help with the side effect of constipation, and it does not cause increased or very intense psychoactive effects or a high. So it's a safe option. As I said earlier, the inhaled route is not preferred for me because it causes, some respiratory effects. If you have COPD, I would not recommend using inhaled cannabis. But for some people, especially I'm thinking about my patients that have the chemo-induced nausea and vomiting. If you're nauseous, often taking something orally is not the best choice. So I have some patients that do like the inhaled method, and I recommend using a dry herb vaporizer. Google it. It's heating the cannabis below the burning point so it releases much less tar and other irritants into the lungs while still delivering the THC, the CBD, whatever you're vaping, without burning it. So, if you need to use the inhaled route, there are some harm reduction measures and some strategies you can use to do that more safely.